Welcome, everyone, and thanks for joining us tonight here on YouTube for our online seminar programming. I'm Darcy Furness, the nutritionist in the South Surrey Choices location. We're working hard to keep everyone safe as we navigate the pandemic. So check in with your local choices to see how your nutritionist can help provide you with free nutrition information. And to stay in touch with all things healthy, you can sign up for our website at choicesmarkets.com and receive our monthly newsletter in your email inbox. And you can also follow us on Facebook and Instagram. Let's just mute myself here. There we go. So a couple of housekeeping details. After the seminar tonight, we're going to be sending you an email link around 8:30, and in it will be a short survey. And we'll also be asking you to provide your full mailing address for us. And we're going to be mailing you one of these. We call them Nut Bucks. It's a nutrition coupon, and it's worth $10 off a $50 purchase. And you can put that towards anything in the store. And tonight, if you have questions of Dr. Nibber, you can enter them into the chat portion on YouTube. You'll need your own account and be signed in to do this, but no worries. If you have any questions that go unanswered at the end of the seminar, you'll be able to go through Dr. Nibber's website to ask her directly. Also, just know that Dr. Nibber offers a complimentary meet and greet, which is a great opportunity to learn more about naturopathic medicine and to see if she's a good fit with you. She's one of my favorites, so I think she'll be a great fit. Anyways, tonight I'm delighted to introduce Dr. NavNirat Nibber. She has a passion for women's health, and her unique approach combines ancient healing practices with evidence-based innovative scientific therapies. She's a graduate from the Canadian College of Naturopathic Medicine and is a medical advisor and brand educator for AOR. Dr. Nibber strives to ensure that her patients are empowered to make sustainable changes towards their long-term health goals. Tonight, she's going to educate us as to how we can interpret our test results. So without any further ado, let's welcome Dr. Nibber.
Thank you so much, Darcy. Thank you, and welcome everyone. Thank you for having me on this lovely Wednesday evening. It's a lovely fall day, and I am so excited to be presenting kind of a continuation of an empowered health decision-making series that I've developed through the course of my practice, which really focuses on how we interpret and synthesize some of the lab work, the imaging, some of those deeper investigations, and how to help patients really navigate through that process, advocate for themselves to get different types of testing done, and really do some of that preliminary interpretation, so that when you go into situations where there may be abnormals, that you're equipped with some information so you can ask the right questions. I am a naturopathic doctor, but I would like to kind of put this disclaimer that this is very much about education on some generalized topics. I'm unable to provide specific recommendations, and that should be something that you and your healthcare providers have more of an in-depth discussion about. And I hope this triggers the opportunity to have those discussions, and really make sure you're advocating for yourself. This has not been reviewed or evaluated by Health Canada, but I find this information is really vital in terms of really looking out for your long-term health care. Like I mentioned, I'm a naturopathic doctor, and it's why are naturopaths kind of uniquely positioned? And I think the answer is we get the luxury of having additional time to spend with our patients, and we're afforded this luxury of building those intimate therapeutic relationships whereby it's much more collaborative, and we're able to actually speak to not just your current health condition, but also where you hope to get to and what your long-term health goals are. And to do that, sometimes we need to understand the myriad of factors that contribute to your health. And sometimes that is just taking a deeper look inside. So testing is a big part of my practice. As a naturopathic doctor, we are able to requisition lab work for you, and in the province of BC, and we often do go through patient's lab results so that you're really understanding on a granular level what's happening and looking at trends, which we'll get to. So today, we're really gonna try to hone in on some key concepts of why we test, when and who you should ask for your testing, what that process kind of looks like, as sometimes it can be a bit murky waters. What types of testing and imaging are even available, because sometimes just understanding that means you can advocate and request certain types of lab work, especially when you know something, just something's off and you want to get that deeper look. So we'll get into the common lab tests and areas where perhaps you need to ask for additional tests, and sometimes what the standard of care is. And then how you store and keep those results, because it's very important for continued and consistent care that you are the owner of your file and you're able to transfer to different practitioners, and really reduce risk of miscommunications or some information being lost in translation. So why do we test? I kind of alluded to this earlier. We test because there's often a need to understand on a deeper level what is going on. So our bodies are these complex and beautiful machines, and we have such immaculate physiology that sometimes when there is something wrong, you would never go and assumes that something is wrong with your car and just, jump in and put oil in, when really it's an issue with the battery. This is my very limited knowledge of cars coming into play here. But the idea is similar with the human body. It's we have this complex physiology. So you really want to understand and look to why you're getting a headache instead of making assumptions about all these different things, especially for those chronic or persistent symptoms. It's really important to try to understand where the root cause is coming from, because then you can actually stop the bleed instead of constantly having to have symptomatic support and kind of, it's almost like a band-aid solution versus really trying to correct something. So we often do additional lab tests. Either they can confirm or initially detect why individuals have the symptoms they have. So there's a confirmation component to that. Sometimes lab tests are much more telling than sometimes the symptoms, as there's a lot of variability with symptoms. But that being said, the best clinical assessment is the marriage between the clinical symptoms that you're currently experiencing as well as a lab test. They should really be going hand in hand. It's not one or the other, which again is why we have that luxury of time. We can really zone in and understand what symptoms you're experiencing. The second area of why we're testing is screening and prevention. So it's important to try to think ahead, understand what some of your risk factors may be based off of your family history, based off of certain lifestyle choices. I always use the example as vegan vegetarians, we're making certain lifestyle choices, and how does that impact iron levels or vitamin B12? Testing helps us make sure we're being cognizant with the lifestyle choices we're making and how that's impacting our health. And finally, assessment and treatment, to really assess how our treatments are working, if they're safe, if they're efficacious. Testing provides kind of that proof. The proof is always in the pudding of if a treatment is working safely. If I'm supplementing with vitamin D, one would expect vitamin D levels to go up. And if you get to a certain point, then you can stop supplementing. So the safety then changes. We want to make sure we're within those optimized limits. So it's very important to kind of begin that testing journey and have a baseline. So I always recommend when I start working with patients is that we start to build subjective and objective tools, so that as I hope we're in a long-term therapeutic relationship. Over that time, we periodically check in to make sure that there's progress happening, to make sure that you're moving in the right direction and that you can see it with something tangible. So subjective assessment tools are those that you provide insight as to how you feel. So it is your own interpretation of your symptoms and your health. So these are things like assessment questionnaires. It can be things like essentially it's usually questionnaires. It can usually be a visual assessment tool to say, okay, today I felt really good. Yesterday I didn't feel so good, and you're tracking it over time. Objective tools, these are things where the lab tests really come into play. And there's a number of objective tools that are based off of the practitioner's assessment or some sort of observation of you, the patient, and how you're progressing. So these tend to, sometimes they have their own biases, but generally they're meant to be non-biased, fact fact-based, and they can help rule in or rule out certain conditions. But I think it's also really important to note that your subjective assessment of your symptoms is very important still. That is something to consider and not to be written off, because that is your assessment of how you feel, and that's your quality of life. So we never want to discount or discredit them, and unfortunately that sometimes happens where practitioners, sometimes we depend too much on the objective tools. So when there's a good, robust discussion, the subjective tools are so important. So always try to keep some sort of track, some sort of record before you go in to see your practitioner, so you're able to give them kind of a temporal or a how things have progressed over time. And we'll get into how you ask for that. So really, when you go in to see any sort of healthcare provider, you are telling them about the symptoms you've had. Sometimes you tell them about multiple symptoms over multiple conditions, or sometimes it's just more acute. But in any case, you always want to present your symptoms. We use this acronym, this low Dr. Ficara, in terms of how you present and how we can assess. These are key points of information around your symptoms that help practitioners make decisions on additional testing, make decisions on treatment, and really help us understand and diagnose what you're currently experiencing. So it's always important to know the location of any injury or any concern, when it started. That onset is really important, and how long, duration is really for things like headaches. How long is it persisting? Is it radiating or going anywhere? How frequently are you experiencing this symptom? If you have to put it on a scale of 1 to 10, how intense is it, compared to other things you've experienced, or someone, the worst pain someone's experienced would be a 10 out of 10. Where does it rank on that? How would you describe the character of, if it's pain or a particular sensation? How would you describe it? Are you having any other associated symptoms? Maybe you're also thirsty every time you get a headache, trying to make those links. What relieves it and what aggravates it? So again, by using this simple kind of template of low Dr. Ficara, when you go in to present those symptoms, will generally lead to either additional lab testing, a diagnosis, or a treatment option being presented to you. Okay. And I'm sure most of us have experienced this at some point in our lives. It's also really helpful to get lab work if you haven't had any in a significant period of time. So I said if it's been greater than a year, and that can vary. I mean, if it's been greater than a year and you have symptoms, certainly it's always helpful to get that lab work. If you have no symptoms and it's been greater than a year, that doesn't always mean you need lab work. But if you have specific health goals that you want to work towards and you're about to start a new treatment, or even a self-administered treatment such as supplementation, it's helpful to get those lab values. Even though you feel otherwise healthy, it'll just help streamline what those lab values are. Now, it's always that kind of determination between public health and making sure that we're not just over testing, because that is in fact a real thing, is over testing, but then also ensuring that you have baseline values, especially like I said, if you're about to start a treatment or self-administer something, or if you have very specific future health goals that you want to engage in, it's helpful to get that baseline. So again, the general rule is if it's been over a year and you have symptoms, if it's been over 5 years and you have no symptoms, then maybe that's the time, or if you're starting a treatment or some sort of high-risk procedure. This can be facilitated by, again, presenting your symptoms in this kind of low Dr. Fikera way. Who you can request testing from varies from province to province. In BC, like I said, naturopathic doctors are able to, if they have prescriptive authority, are able to requisition lab work and provide prescriptions for some pharmaceuticals as long as it's within our scope of practice. But it is also important to know that this does get billed outside of MSP. So it does require patient payment, and this can change, whether you're able to access it or not. And you still always have the option of working with your GP or your general practitioner to get some of that lab work. And I think, as any naturopathic doctor will attest, it's always best to work with any other healthcare providers, so that it's as smooth a transition and the least amount of work for you, the patient. But also making sure that you can always ask for additional lab work, particularly because at the end of the day, we know our bodies best, and it's important to ask for lab work that you feel may be relevant to you, especially based off of what you already know about your risk. And then making sure that healthcare providers are able to provide you with the relevant insight as to why they're recommending certain lab work. I mean, they don't need to get as granular all the time, but particularly if you have questions about your fatigue, asking them which tests they're running and why can be quite quick. And also, I know when we get our lab work back, oftentimes it's no call means it's good or everything's normal. But as you'll see, sometimes naturopaths we have a different range of what's normal. And we're looking, again, from that long-term chronic health perspective, we're looking at trends, we're looking at ratios of things. So while it may appear normal, we're also looking at how we can synthesize that information and look at it over a long period of time. And again, based off of what you told us your health goals are. So what are some of those options for testing? I think we've all probably experienced some sort of lab test where we go and get our blood drawn. So this is serum testing, so it's blood tests. And there's a huge number of tests where we can see those markers in the blood. And again, there's lots and lots of tests available. There's lots of reasons why some are run and some aren't that we'll get into. And there's lots of reasons why you would choose blood over, some of these other options. And access is a huge reason. We have, it's fairly easy to go and get your blood work done, especially if you make an appointment, or, all you really need to do is go in and get your blood work run. But some of these other forms of testing can be a little bit more cumbersome. So there's easy access points. There's a lot of place to do it. And again, it's fairly subsidized by MSP. So it's easy to access for patients. There are other types of testing, urine. This can tell us a lot about your current health, your immune function, your kidney function, as we'll get into, and sometimes hormone. Saliva or salivary. We do fecal stool tests, particularly important when we're talking about digestive health. Breath tests, this can be for digestion, for things like H. pylori or any other infection. Then, of course, there's lots of imaging. And we're now seeing this rise in functional tests and functional testing. These are somewhat more specialized tests that are being offered, outside of a GP office, and they can be really helpful in really getting into some of those difficult to treat and hard to understand conditions. So some of the considerations just in general for when you are preparing to get some lab work done, particularly if it's blood testing, things like fasting. I get asked often, how long should I fast for? The general rule is if you're getting some blood sugar testing done, at least 8 hours. And if you're doing any lipid or cholesterol panels, make sure you have 12 hours of fasting. So it can be first thing in the morning. That can be pretty important to go and plan your day accordingly. And in terms of when you fast, that is usually based off of what is easiest for you. And keep in mind that while you're sleeping, that's considered fasting. So yeah, if you just stop eating the night before and don't have any late night snacks, and then you have a test first thing in the morning, that usually you're good to go. And they always do ask, how long it's been since you've eaten. The really tricky one, again, is just making sure that lipid assessment is done. And that means you can have water, but no juice, no coffee. It needs to be a true fast. Okay. There is such thing as over or under hydration when you're doing certain tests, particularly with urinary hormone tests. You don't want to overhydrate and dilute, but you also don't want to be dehydrated. I mean, in life, you don't want to be dehydrated. I think we could all stand to, drink more water. So it's important that you are still urinating regularly and you have that clear stream if possible. I mean, some people don't have a clear stream because, let's say, they have an infection, and that will impact, how much they're probably drinking. So with a urinalysis, it's important also to make note of how much fluid you've had in that day. That can sometimes help with interpretation. You may have seen that exercise, particularly if you're doing some of these blood tests where you also need to be fasted, exercise can impact those results. And the reason being is, one, you're increasing that blood flow and tissue. And for things like some of those muscle breakdown markers, those may come up higher because you've just exercised. So you don't want to do anything, very strenuous that morning or the night before you're getting lab work done, because that can change. And if you are, make sure that's something you mention to your healthcare practitioner. It's like, I did work out right before, and that's what changed those values. And then, like I mentioned, timing is really important. So aiming, if you're doing your morning cortisol, for example, is your stress hormone, it naturally goes up in the morning, first thing in the morning. And if we're looking at things like your adrenal health or your stress response, it's helpful to get a true first thing in the morning reading. This becomes significantly harder if you have to go to Life Labs and wait in line. That can stress you out. So then your cortisol won't be an accurate reflection. And in these cases, sometimes a urinary cortisol test is more appropriate. And that's something you really want to chat with your doctor about is, should I be getting a blood test for my cortisol, or is a urine test more appropriate based off of what we're trying to look for? Okay. So timing of the lab tests is really important as well. So have you eaten, your hydration status, exercise, timing, and then for other tests, there are certain um, other considerations, particularly with female hormones and where they are and where you are in your cycle. What day of your menstrual cycle you're on is important to note as well. And it does change things like your FSH and your LH, your progesterone, your estrogen. Those fluctuate naturally with your cycle. So when you go and get them done, it's also an important consideration. And again, those all should be explained to you and should be consistent with the symptoms that you're trying to assess for, or whatever your healthcare practitioner is kind of suspecting, and that's why they send you to get these tests. It'll be consistent with that. So when we look at some of the major serum tests that we get, the reason that we use serum tests so much, like I said, is there's easy access point, and it tells us so much about your current health status. And oftentimes there are things that show up in blood that really help us say, yep, this supplement's working. Your iron, for example. We'll get into that in a second. But there's lots of important information that can be gathered from blood tests. So oftentimes they all start off with a CBC. This is a complete blood count with differential, and that just means that we're also looking at the breakdown of white blood cells and the specific types that may be, whatever levels they're in, which could also tell us about infections or any autoimmune conditions. So we do a white blood cell count and a red blood cell count. And these are just, that's part of usually a basic blood panel. And, because it's so ubiquitous, often it gets forgotten, but it can also tell us a lot of really helpful information. For example, with your red blood cell count, there's often specific markers like your MCV or your MCHC. And if these are abnormal, the pattern of abnormality is what's really important. So it's not always just a static blood test, but it's, everything in concert. So if you're, as a healthcare provider that's looking from a preventative health standpoint, I want to match ferritin levels and trends in ferritin with trends in hemoglobin, because this is important because iron deficiency can lead to anemia. So if your iron's starting to go down, and for the time being, your hemoglobin is normal, but eventually your hemoglobin might start to become abnormal. So as a preventative specialist, I'm looking at making sure we don't get to the point where your hemoglobin starts to be abnormal. Like, that's the goal, is prevent, because we're thinking ahead of your long-term health goals. Now, we also run a lot of specific blood markers. So these can be, things for your metabolic health. We'll talk about blood sugar management. Endocrine is your hormone management. Like I said, depending on where a woman is in her cycle, there'll be day 2, 3 tests in your cycle. And this is where it's best to test your FSH, your LH. And then day 22, 23 in your cycle is often where we try to get those blood tests for progesterone run, because that's when we see peaks. And this is based off of when we should naturally, based on your physiology, be seeing peaks and flows. Okay. Then, of course, I'm always looking at vitamin nutrients for my patients. Are you, again, on a restrictive diet? Is there anything that could be causing some sort of nutrient deficiency, a malabsorption issue? That'll be really important. And then particularly with anyone who's on multiple medications, has a long-term chronic condition, before I start any supplementation regime, I want to make sure it's safe and going to be effective. And the safety part of it really comes down to, can your liver process and can your kidney excrete anything new we're putting in? We don't want to start overloading the liver and kidney function. So we do want to make sure that we're doing assessments on, yeah, can your body handle this additional stressor, or is that going to make things worse? Now, again, everybody always assumes it's natural, so it's well tolerated and it'll be safe and it's always safe for use. And that's not always the case. Safe supplementation begins with understanding the person who's taking the supplement. And that's really what veers it from appropriate and safe and going to be effective to something that is either harmful, worst case scenario, or best case scenario is ineffective. So it's really important to get the right person. Now, some of the trends that I wanted to bring up that I get asked about a lot in my clinical practice is, there's the baseline tests, which essentially are screening for a gross abnormality. So this is saying this one test tells us if something is really, really wrong. And from the perspective of acute management and, your GP is doing a great job of making sure you're staying alive and there's no acute issue. But if we're looking again for those long-term or health optimization, sometimes it involves or requires investigation beyond just those one marker. So a good example of this is thyroid function. So our thyroid is this endocrine or hormone gland that is at our neck, and it provides active hormone, so T3 and T4, which then go on to influence our metabolism. This really influences how we carry weight, our energy levels. It can also influence, hair growth and our skin changes. And oftentimes I see with fatigue, that's usually the first area that it creeps up, is if someone's feeling really lethargic, very fatigued. Sometimes we need to investigate at least what is going on with your thyroid. And the first result is, or the first test that usually gets run is their TSH. Now, this is also where the difference is between naturopathic care and general practice care is different, because the ranges, I would say, for a naturopathic practitioner are a bit more narrow in terms of what we would consider an ideal range. Now, every lab that runs your tests calibrates all of their tests. They have a range of normal. Okay. And that range is based off of a number of things, their equipment, the population base, and they have those set standards. So that's why anytime you look at blood work, next to it, there is a range of X value to Y value, or something has to be less than a certain amount. And it usually does say that on there. Now, with your TSH, again, you can range from 0.34 to up to 5 and still be considered within normal. But if we're looking at someone who is also exhibiting a lot of the symptoms, so let's say they have, again, that fatigue, that chronic fatigue, they're losing some of their hair, they feel their skin is more dry, some of these non-specific symptoms, and they're having a lot of trouble losing weight, they're just gaining weight and feel more sluggish, then we consider, thyroid function, but they say, well, my doctor ran my TSH and they said it was normal. At this point, there are conditions called sub-laboratory hypothyroidism, or you can have an autoimmune type hypothyroidism. So the TSH, while a very important marker, doesn't always tell us about the different types. So this is why a complete thyroid panel can be really helpful. So things like T3, T4, those are the active hormones. So the TSH, if you think about it, that's like from the brain, that's that hormone regulator. If that is, very, very high, it can indicate that, your thyroid is actually a bit sluggish, or if it's very low, then you're having a hyper type thyroid picture. So it's also helpful to see, not just from the central nervous system, but also from the gland itself, how is it producing the T3, T4? Now, usually when TSH is normal, they cancel testing T3, T4, but you can request that they also test they do a complete thyroid panel, particularly if you are having, again, a lot of those typical thyroid symptoms. Also, it's important to note that there are autoimmune types of thyroid conditions, such as Hashimoto's, and this is where there is your own immune system is kind of attacking and it's dysregulating. You can go through periods of both underfunctioning and overfunctioning. So depending on if you're going through kind of one of those fluctuations, you may catch a small period where your TSH is normal, but it's also important then to look at, again, the T3, T4, your TPO, your antithyroid globulin, and these together give a complete picture of not just how your thyroid is functioning from the central nervous system, but what are the other markers. So this is where, particularly for those really stubborn cases, I advocate for my patients to get more complete testing, because it will help us understand your fatigue or your weight gain, or your malabsorption condition. It may help it might be that missing link, and sometimes you can see that once you do the complete panel, suddenly there's a light bulb moment, and that explains a lot, and you can then change your course of treatment to be much more specific. Okay. Another area where we see a lot of, I guess, misleading lab work is in iron. So when we assess for iron, generally it's as ferritin, and ferritin is your stored form of iron. The range is with some labs is from 15 to 250. So quite a large range, and someone functioning at 15 is very different from someone functioning at 100 or 80 to 100. Those experiences and ability to function is very different. Because ferritin is also the stored form, it tends to be a bit of a slow responder to any changes. So by the time you really detect that very low ferritin, and you're described as having low iron, by the time that's actually recognized, you may be at your actual iron level in tissue is much lower, and that can attribute to why you feel those heart palpitations, very low energy, loss of pallor, because iron is so important for our red blood cells to help transport that oxygen to different tissues. So if you don't have the iron to be able to do that, it can explain why you're pretty fatigued. And I see this a lot in young women, is they're told your ferritin is normal, but it's not optimal. And if you're on the low end of normal, we don't want to have to wait until you're feeling terrible to get those benefits. So it is about that, forward thinking. So a complete iron panel to really understand, and again, this comes back to what is the root cause, understand not just how your body is storing the iron, but also how the concentration of the binder. So is it accurately binding? So your TIBC, is it able to bind and then move around your body? Or is something blocking that process? Also, how much iron is actually in the bloodstream at that moment? So your serum iron. So it's, ferritin tends to be the one that is most sensitive specific. But if we're looking at patterns and we're trying to understand where where everything's going wrong, it's important to get a full iron panel. Okay, and especially if you're chronically iron deficient, it's not enough to say, eat more iron or just supplement with iron, because sometimes in cases such as small intestinal bacterial overgrowth, even if you're supplementing with iron, there's a dysbiosis, or the bacteria in your gut they're taking it first. So it's important to understand iron, not just if it is or is not low, but also why it is or is not low. And that is where, again, we have that marriage between your clinical signs and symptoms and what you are explaining to me as a doctor, and also the lab work. So we're putting those two concepts together. Another area is your fasting blood glucose. Oftentimes it's, your blood glucose, if you haven't fasted, or your fasting blood glucose is probably more accurate. And it's saying how much sugar is just in your bloodstream at any given time. And then the more accurate indicator, especially if we're looking at things like your risk for diabetes, is called your HbA1c. And this is a more accurate indicator. And if anyone has struggled with blood sugar dysregulation, either with diabetes or insulin resistance, they're probably very familiar with these two numbers. Where I don't think we get as much insight is insulin sensitivity. And the reason we might not be getting a lot of that insight is because the test isn't particularly sensitive or specific. So it's not always run. However, you can do a fasting insulin test, and then you get kind of that combined with your fasting blood glucose gives you something called a home IR value. And that can, again, start predicting some of your risk. Are you developing an insulin resistance? Things like that. I know in pregnancy, a lot of times women are screened for gestational diabetes. And at that point, if it comes back a little bit high, then they conduct something called an oral glucose tolerance test. And this test is essentially a challenge, seeing how long it takes over time for your body to uptake and take up the glucose. Now, again, you always want to consider this in context of the symptoms you're currently experiencing, as well as family risk and your current health, other health markers, things like your blood pressure, your cholesterol levels. So in context, everything is really important in context. If you take nothing away from this, just know that you can ask for additional blood work, and you need to ask for the context of why you're running certain blood tests. Another area we're seeing a lot more growth in, particularly since the pandemic, is in vitamin D levels and understanding your vitamin D. This is usually not covered by MSP, so it is an additional cost if you want to understand those blood levels. Now, the assumption is often that Canadians, because we don't get as much sun exposure, particularly here in Vancouver, you are going to be a little bit vitamin D deficient, and it's quite safe to supplement with. So, oftentimes we're just given a vitamin D and told to supplement. But in actuality, there's a few things that could be happening. One, if you don't know your true baseline levels, you don't know how much to be supplementing for, what a safe level is to supplement to. And you do have a risk of vitamin D toxicity. If you start supplementing too much, too high, too fast, then you can see that there are toxicity. The second issue is if you don't know your baseline and then you start supplementing and things aren't improving, it might be because there is an inability to convert the vitamin D you supplement with to the vitamin D that your body can utilize. So it's important, again, to get a baseline marker and then retest it to see, okay, is this supplement actually working for me? It's also really important to note that this fat-soluble vitamin is best always taken in a fat base or with fatty foods. And there are two types of the test. So there's the 25 hydroxy vitamin D, and then there is the 125 dihydroxy vitamin D. So the 25, so the first one is actually just the inactive form, and then the 125 is considered the active form. But it usually is very sufficient, and the preferred form for testing seems to be this 25 hydroxy vitamin D. So these are areas and tests where, again, sometimes what the standard of care is sometimes misses some of those pieces, for especially if you have a long-standing condition, or things are coming back within normal, but you're still not feeling good. And this is where a discussion is warranted to ask for that additional testing. Then we see with some of the other types of testing we do. So that was with the serum. We perform urinalysis. This is usually quite easy to do in the clinic. So we can perform that with patients. And a urinalysis is where my picture is not working for some reason, but it's where you pee into the cup, and then we're assessing for different markers. So things like specific gravity, if there's protein in your urine, if there's blood in your urine. It's a very quick and easy screen for that. It is meant to screen for any genitourinary diseases, if there's bacterial infection, kidney infection, metabolic disorders, if there's too much protein in your urine, and occult diseases. This again is that blood in urine. So these are often done in practice, and they're quick. But we also do see urine tests with things like pregnancy. Hormone tests can be done, especially if we're looking at how hormones get broken down, or those metabolites. That can be done through urine tests and urine assessment. And then again, how are our kidneys filtering? How good are they at filtering things out? That's where urine tests can come in. So I don't want to get into some of those other types of tests that I talked about, but know that there are options. Things like breath test for H. pylori is really important. To make sure we assess for that, because sometimes just blood or stool don't cut it. We want to know if it's active. So breath test is there. And then also keep in mind that a lot of these tests, particularly if they're covered under MSP, sometimes there's also public health decisions that guide and drive why it would be recommended and why not. So, the assumption is not always that your doctor doesn't want to run them. It might just be that, given the parameters that they have, they're only able to request certain types of blood tests, and then it becomes more of a discussion and an opportunity for you to ask the question as to why they wouldn't run something. And this is also where specialized testing has a role. As a naturopathic physician, we get asked about specialized tests a lot, because I think it does get driven by that need or desire to understand, again, from the root cause of an issue as well as preventatively. It seems like we get told a lot that, the blood test was normal. So, we don't have the luxury of the time in this setting, or they're looking more at the acute cases, and specialized testing offers, again, a bit more in depth. Now, there's lots of types of specialized testing. There's hormone testing. There's, things like food sensitivity testing, SIBO, genetic testing we're seeing a lot more of now, different gut health assessments and seeing what your microbiome is like. All of these do have a role. Now, there are a few reasons why they can, hold some of us back from testing, and the reason that they're not incorporated into your general practitioners' health recommendations. There is a barrier to entry in terms of sometimes these can be much more costly tests because they're usually done out of private labs. You're sending them somewhere else. They're multi-step. So there is an additional cost to it. The second thing is that sometimes they require their take home, and they require very specific conditions. So things like a SIBO test, you have to do you have to fast before you do it. And then, then you do a breath test. So there's a higher risk or degree of risk for it not being done properly. It can't be done in that supervised setting because often it's a take home. And then the most important is how validated are these tests, because a lot of times when I talk about validation, there's two concepts. There's how specific and how sensitive is this test. So how specific can it help rule different conditions in, and how sensitive is the test can it help me rule out a condition. And you want tests that have high specificity and high sensitivity and that are validated. And the way you validate is you get a whole bunch of people to take the test, and that's what gives you those reference ranges. So given the novelty of a lot of these tests, they haven't built as robust, reference ranges. So what is considered normal? Sometimes you can get things like false positives or false negatives. Now, there's again a lot of variability between each of those tests, but it's important for you to have the conversation with whatever doctor, whether it's a naturopathic doctor, a functional medicine doctor. Ask them about I always say, the three most important questions when you're getting these specific, specialized tests is, if I do this test right now, how does it change the course of my treatment? And what if I did this test in 6 months? So what is the urgency of doing the test right now? And how is it going to change my course of treatment? Because if the doctor comes back and says, well, I'm going to put you, I suspect strongly that you have, this hormone imbalance, and I want you to eat more cruciferous vegetables, and that happens with or without the test, then it's important to understand why the test is being run. And again, a healthcare practitioner knows, again, their thought process as to what pathways it can lead down. And it sometimes is really important because it does change the course of treatment, whether you are, if your cortisol is very elevated or depleted, it's going to change the type of support and adrenal support we can give, and how you modulate that is going to be very different depending on what stage of that resistance you're kind of in. So I think as practitioners, we always err on the side of more information is better. And I think as patients, again, it's the same rule, is we want to know more, and we don't want to be shooting in the dark and playing a guessing game. However, that has to be balanced with the fact that there are some significant barriers. So when you're being recommended additional testing, it's always good to ask how it's going to change the course of treatment. It's also really important to ask what the current gold standard of treatment is, of testing is. Like I said, with insulin sensitivity, insulin insensitivity, the gold standard is actually quite it's a clamp technique that has to be done in a hospital setting. It's quite difficult to do. So if you're getting that score, that HOM-IR score, know that that's not exactly the gold standard, but it does give us a good concept or idea. So it can help put us in the right frame of mind, or if we're just screening something, maybe we don't need the gold standard. We just need to assess and maybe rule something out and say, okay, well, we don't need to worry about that. And then it's also important to have a discussion with, what your options are to access the test, particularly with some of these more expensive tests. Can it be run? Can you collaborate and run it through a GP, or is this, something that isn't available, and why? And then also asking if you can do different stages of testing. So sometimes we start with a blood test and make some lifestyle adjustments, and then we run into other things. Something that I get asked about a lot is food sensitivity testing, and to be quite frank, I don't often run it in practice. It provides some insights and guidelines as to foods an individual might be sensitive to, but note that, again, there's always a risk of false positives. There are different types of tests available, which also assess for not just a delayed immune reaction, but then also if there is inflammation present at the same time, and this can limit some of those risks. So, without getting too much into it, it does need to be a discussion, and there are options of, self assessments first, and then also if there is an acute dysbiosis happening, that can change those results. So that's where timing of the test becomes really important. If I have a patient with active SIBO, I don't want to run that kind of test because it will come up really high. Everything will be, you'll be sensitive to everything seemingly. Whereas if we run it after kind of helping heal the gut and get those foundations in place, then you're more likely to get a much more accurate reading. So it's really important, again, dialogue and discussion of when you should be running these tests is important. When it comes to interpreting our results, I've kind of already alluded to the fact that there's these reference ranges, and as naturopaths, or if you're looking at preventative medicine, you may have a more there's kind of like a narrow range, and you're looking more at the therapeutic support. But at the end of the day, the key pieces of information are, what are the trends over time, which is why it's sometimes helpful to get on, this is an image of the My Care Compass. There is this analytics section, and thank goodness now they're allowing you to see, okay, so my hemoglobin in my last visit was just on the border and almost low normal, and now on this next reading it's actually low. And then you look also at your iron, and surprise, surprise, that's also really low. So again, it's helpful to have trends over time. Okay, and the other thing is ratios. So as an ND, I'm looking at what is your ratio of HDL, so that good healthy fat, to things like LDL and total cholesterol, because that can really flag if there is an issue with blood sugar regulation or insulin resistance. You can also just tell us, what kind of healthy fats you're getting in your diet or not getting, and your cardiovascular risk, which is the most important thing with cholesterol. You can also, there's a lot of really helpful tools. So there's lab tests online, the My Care Compass. Those can help you interpret. Again, I'm hesitant to say you should interpret your labs, but it's helping you contextualize your labs, because again, sometimes we see an abnormal that is not, as concerning, given, like I said, your clinical picture as well as other signs and symptoms. And sometimes we see a trend that it should have, maybe more attention paid to it earlier on so we can prevent something. So it doesn't need to be a solitary activity. I don't want people to be interpreting lab results. We go to school for a really long time, so it's good to collaborate with someone. But at least this way, you have some of these tools, one, to help you identify that, so that when you do get that time with your practitioner to go through those results, you kind of can contextualize and understand what you're asking about and what the test was initially testing. And it's also great for, just general insights. Also, a good life hack that I've been using a lot is the Save My Spot. This is particularly good if you don't want to wait for a really, really long time before you can get an appointment for your lab work. Save My Spot is a good app. So it's just my little pearl. The last area I want to chat about is record keeping. So just ensuring that you are, you feel empowered to keep your own health records. So I always encourage my patients to build themselves a health binder. And this binder should contain any lab work or imaging that you've had run, access to trends, subjective assessment tools. These will be things like questionnaires I give them, or handouts, things like diet diaries, tracking over time your own perception of your wellness, as well as a list of any medications and supplements. And what's really important about that is always know the dose you're taking, the brand you're taking, and when you first started taking it, because that's important in terms of, again, some of those lab works may be influenced by that. If we're starting to see liver function change drastically after you've started a new medication, that can talk to, safety of that medication for you. So these are things that need to be done over time. It can be really overwhelming, especially if you're going from different practitioners, from one practitioner to another. It can feel really overwhelming, having to explain everything and not knowing if you've explained it in the correct way. Whereas if you keep a detailed health record, you're able to provide that. And again, you don't have to be so old school about doing it in a health binder, but you could have, a folder on your computer somewhere where that information is consolidated. It's also really important to recognize that you own your health file. That information is yours. Doctors keep a record of it, and we're kind of the stewards of that information. And there's a duty for us to protect that information, but it is in fact your information. So if you want access to it, you're allowed to request that. You're allowed to make those requests for access. Sometimes there are fees for printing or having that physical copy, but yeah, that is your information to access. And that's why we're also seeing things like My Care Compass, where it's become much more accessible to see your blood work in real time, before you have to go and do a consultation, which is different from how it was even 5-10 years ago. So always keep a record of your lab work. Always make sure that you can ask for additional lab work, particularly if you have seen over time a course of treatment is not improving or helping your subjective symptoms, and or you have new health goals and you want to work towards something new. If you want to optimize your health, it's always helpful to get that baseline of lab work done. And especially if you're working with someone such as myself who has more specialized practice and is really looking at understanding the root cause, there will invariably be a point where we're looking at and discussing what your options are for additional testing. It's pretty rare where that doesn't happen. So thank you again so much for your time on this Wednesday evening. We have a little bit of time for questions. These are all the places you can find me. And yeah, thank you again. Darcy, do you know if we
Okay, so I'm back. Thanks so much, Dr. Nibber. I've just noticed that I entered the website incorrectly when I first put it in. I just put in crescenthealth.ca and it should be crescenthealthclinic.ca. So I've just re-entered that into the chat, into YouTube. So please make a note of that if you're interested in pursuing. Yeah, we have a couple of questions here. One concerning iron. And the first, we had a nice thank you for explaining a bit about iron. It is very confusing. The question is, this person was diagnosed with iron deficient anemia and was prescribed an iron supplement, but he or she is wondering, the doctor didn't provide an explanation on why they're lacking iron. What steps can this person take to determine the cause?
That's a great question. So there can be a lot of causes for iron deficiencies. So this can be related to not getting enough. So you're not consuming enough, either from your food sources. This is more common, again, with vegans, vegetarians, or anyone who has some sort of malabsorption. So it's not absorbing properly, that iron. So that's number one. Number two is you also want to look at, is there an anemia of chronic disease? So do you have, again, some sort of underlying issue that is using up that iron that you are getting, especially if you do eat an iron-rich diet. So that's important. This is also important with, young women who may have really, really heavy periods, or or anyone who is losing a lot of blood. There are a lot of, genetic conditions as well. So it's difficult to say, this is exactly why, but it does warrant further investigation, especially if once you start supplementing, if after 3 months your levels aren't going back up, then, that's especially a really important time to start asking for additional investigations. And so that might look like doing tests regarding inflammation in the body, doing tests that assess for your immune status, and again, a better and more in-depth view of your diet and digestion.
Okay, another question that came in concerning the ranges around test results. Are the wide ranges for results adjusted for age and or gender? And is the middle of the range optimal for results? Having normal blood results, is once a year enough to request blood work?
Yeah, again, great question. So I guess the answer is it depends. Sometimes things like TSH, your thyroid, that is age adjusted, and it is time adjusted. Things like your kidney function, that's also age adjusted, because as we age, that does get lower. So yes, there are some things that are age and sex adjusted. Now, there are complications in terms of ideal ranges, and then again, those wider ranges. So generally, like I said, you don't have to fall right in the middle. Sometimes being within the range is enough, but it really depends, again, on your entire health history. I know that's a very unsatisfactory answer, but it all comes back to, it depends, and every individual is unique. So when we're looking at, as much as we can being within normal, you also want to look at, how do you feel? If you feel very good and you're considered, normal within those ranges, then that's where it's helpful not to over-test. In terms of that 1 year annual checkup, I think it's more important to have an annual assessment or visit with your healthcare practitioner, so that you can have a discussion about when you should do additional lab testing. But generally, for that baseline, like I said, if you have symptoms and it's been over a year since you've had anything tested, you should really get tested. If, it's been over 5 years and you don't necessarily have symptoms, but you want to start that baseline, you should definitely get, some sort of baseline lab work done.
Perfect. Thank you. Another question here. Are there any vitamins that can negatively affect your liver function, specifically increasing alanine aminotransferase? Don't I just say that like I know what it means, and I have no idea what it means? So over to you, Dr. Nibber.
Yeah. So those are liver enzymes, and we're always assessing to see if they've gone up. We know with some botanicals that can increase liver function and elevate enzymes, and that's not always what we want to see. It means that's overworking. Things like alcohol or lots of heavy medication use over a long period of time can increase those liver enzymes. So we're definitely always monitoring that. Are there vitamins and minerals that can do that? Yes. This also is in relation to your toxic overload. If you tend to get, if you do have sluggish liver metabolism because you're on polypharmacy, or you're taking too many at a time, certainly, your liver is an excellent organ. It's very effective at metabolizing and doing what it needs to do. But like anything, if you inundate it, there can be overload. Now, things like B vitamins, we usually look to that help your liver function, but in very rare cases, sometimes having too much of a good thing can cause some issues there. But I would say, by and large, it's kind of difficult to ascertain. Things like, botanicals, particularly if they're supplemented in really, really high doses for long periods of time, or if they're contaminated with any heavy metals, then you do see elevations in liver enzymes. So again, I always warn people, it's just because it's natural doesn't mean it's completely safe. You want to be looking at the quality of the supplement, the source of the supplement, and if they've done any additional testing. And then also, and maybe this is like my conservative supplementing concept coming out, is try to take breaks from supplements, especially botanicals, if you've been taking them for a really long time. Like try to take a supplement holiday where you go without that, because the concept of supplementation is just that. It's you supplement what isn't working because it's either missing or you're a bit lower than you need to be. But eventually the goal is to help your own physiology, your endogenous physiology, take over and do what it knows how to do. So I'm a fan of supplement holidays. Sorry, that was a very long-winded way to get back
No,
to
that
that
was
end.
great. That was great. I imagine too, things like your pre-existing liver health would also be factored into that. So if somebody had fatty liver, you might notice enzymes raising more than a person that didn't have an existing condition.
Exactly. Yeah. And
Okay.
we're also seeing different populations, different demographics, ethnic, regional, dietary, age, all of those things play into it.
Mhm.
So like you said, we see non-alcoholic fatty liver disease is more prominent in East Indians. And then what does that mean? Does that mean I'm going to test more in certain populations? Yeah, possibly we would do additional tests, but that is again why that screening may be more important.
Okay. Another question on tests. When do you suggest having a ditch test? DITCH, all upper caps. I haven't heard of that one either.
Do they mean Dutch test,
Maybe,
possibly?
possibly. This might just be a
Yeah.
typo, but yes. Okay.
I'm assuming Dutch test,
Okay.
in which case that is a urinary hormone test, and can be really helpful in helping us understand how your body is breaking down and metabolizing, what pathway it's shunting the hormones, because hormones are very complex. They need a lot of, they can go down many biochemical pathways and it gets excreted in your urine. So sometimes that analysis is really helpful. Now, when is it indicated is particularly with individuals with tricky hormone type conditions. So these are usually very general systemic. If you have a lot of symptoms that don't quite make sense, but all together, you're very fatigued, they're quite systemic type things, your menstrual cycle is all over the place, and you've kind of ruled out some of those major disease categories, things like your thyroid function is working normally, then it's a discussion to do something like a Dutch hormone test. Now, that being said, if again, once the foundations are there, if you're still experiencing those, then we would look at doing something like that.
Okay. Good, thank you. A question about vitamin D. The comment, I'll just read it straight up. I remember you touched on vitamin D toxicity. How do you gauge deficiency and toxicity symptoms for vitamin D?
Yeah, that's a great question. So vitamin D is important for bone health, immune health, and mood. So we do see that with Canadians, particularly if you don't have a lot of sun exposure, you are at higher risk for being deficient. And also, we do see that deficiency in those with kind of a darker skin tone because there is that blockage. So there can be a lot of, sometimes we see deficiency more than not, and it's assumed that we're all deficient. What those symptoms and signs can look like is general low immunity. It can be seasonal affective disorder if they get very depressed in the wintertime. Things like some bone conditions, as it also influences your calcium levels. Okay, so that's sometimes where we go with vitamin D. And testing, a lab test is going to be the best way to confirm what your initial levels are. And then in terms of toxicity, generally things like headaches, you get nausea, vomiting, those can be signs of toxicity that you've had too much. It's rare to see a true toxicity that doesn't go back down once you stop taking it. It should go back down quite quickly. So again, it can be transient, but yeah, like it's a real thing that you can have that toxic side effects. It can start as a headache and then you get very nauseous. So that's why we want to retest after you've taken some vitamin D.
So I have a question about sharing lab results. So if I want to, I'm going to my GP, I'm due for some blood work, then I want to come and see you. I can get my own online. I could just share that with you, print it and bring it, correct?
Correct, yeah.
And then the other thing is I can also go through the BC Services app and get into my Healthgate records, and I can get all my health records online myself. And that'd be an easy way to share with a naturopathic doctor, would it not be?
Yes. Yeah. There's a few ways to go about it. So again, thank goodness, we have these tools to really own our own records. So you can certainly bring it in yourself. There's also something called a release of records, which is you authorizing practitioners to request that information from another practitioner. Benefits of this just mean that, that other between the two practitioners, they're able to share their notes and impressions on that lab work or anything that's been done. And it just happens behind the scenes. The difficulty there is sometimes, as we know, there is varying willingness to collaborate between different practitioners, unfortunately. And ideally, we would all be able to share all the information easily, but given that naturopaths are out of the system, sometimes it does make it a little bit harder. But certainly when there's a willingness to collaborate, it always ultimately benefits the patient. So that should always be a goal for any healthcare practitioner. So release of records, like you said, My Care Compass, and then also the BC Services has that app as well.
Perfect. Well, I think that's it for our questions, Dr. Nibber. So thank you so very much for sharing your time once again with us tonight. And everyone, just don't forget to consider reaching out if you're looking for an ND. just a little pitch for Dr. Nibber. I have referred lots of customers who are interested to her, and they've come back with really lovely reports about the care they've received. So her website is there if you have any additional questions, or if you'd like to set up a 50-minute meet and greet. So thank you all very much. And you also have lots of, just another comment from someone. So the website there should be, where did I put it here? Oh, I thought I had it in here. Okay, let's just reiterate that to make sure I'm correct. crescenthealthclinic.ca. And I'm just going to type that one more time just to make sure. Crescent Health. And what kind of hours do you have, Dr. Nibber?
So we're by appointment only, but we're open 6 days a week. So Monday to Saturday. And yeah, you have to book.
Oh, there we go. Okay, perfect. And you've got lots of thank yous coming in for the very informational session, and everyone's very grateful that you took the time to be with us tonight. So thank you very much, everyone, and we'll look forward to seeing you at our next seminar. And stay well out